background on the Health and Justice Institute webinar series. So today we're focusing on the health impacts of systemic racism with Dr. Sakobi Wilson. But to give you a little bit of background on the series, we launched the Health and Justice Institute webinar series to celebrate PSRLA's 40 years of bold advocacy. But as we were also reflecting on the year that we just had last year during, it was the global pandemic and the racial uprisings, it was full of grief and loss, and it really exposed the deeply rooted systemic issues of our society that negatively impact the health of those that are most vulnerable. So in these series, we'll talk about the specific ways that certain communities are made vulnerable to health issues. So through discussion and building our scope of knowledge around intersectional social justice issues, we will be ready to take action and stand together in solidarity. And so now, without further ado, I want to introduce you, as we like to call her in our office, Martha, our fearless leader and our executive director, Martha Dina Arguello.
Good evening, everybody. Thank you so much for joining us. And as we work primarily on environmental justice issues and see very acutely the impacts of racism on health and on communities. And we often talk about our communities being sacrifice zones. And as Rahel said, with the summer and, long working on this issue, but the summer really brought home the need to very specifically begin to talk about racism within health institutions, and everything from how we train doctors, the experiences that doctors of color have through their training and in their practices. And, we felt called to do more. And so this is the beginning of us figuring out, how do we do more? How do we connect with other health professionals across the country who are beginning to take this on? And how do we support efforts to change everything from our medical education and how that embeds racism? And so I really want to welcome everybody and thank you all for coming. It's really wonderful to see old friends like Jan and David and Kelly and Barb. And I feel like Hobo Kelly with the big glasses. That's a really old reference, like really old. So I also, deeply respect the work of Sakobi Wilson. And the first time I met him, I thought, that I just was really excited about his work and the passion he brings and his ability to speak truth to power with the tools of science. And so I'm going to stop talking and hand it over to Sakobi.
Oh, thank you. All right, y'all stop laughing. My oldest is in the room laughing behind me. So you have to be quiet, and she's laughing and watching. Shh. Okay, she's quiet now. I didn't embarrass her too much. But thanks a lot for having me. I'm really excited to be here today. Let me do a share screen. Oh yeah, I think you gotta stop sharing your screen. Okay, I got it, yeah. So, yes, I do have a lot of passion. Hopefully I have enough for this presentation. I've been on Zoom calls since 9 o'clock this morning, but I should be fine. So you think about where we are today in this country, and I'm gonna talk about, environmental injustice, talk about racism and its impacts on public health. And I'm gonna introduce a term, disendemic. In a lot of my lectures, I've been talking about we're not dealing with one pandemic. We're dealing with multiple pandemics, and that's what a syndemic is. I mean, this first pandemic we're dealing with, and you touched upon in the introduction, we're talking about the pandemic of racism. You think about the white supremacy that we have in this country. We have two Americas, right? We have the multicultural America, the America of the Biden-Harris campaign, the America of immigrants, right? Where immigrants are valued and respected, the America where everyone has equal opportunities. Then you have the America of MAGA. You have the America of what happened on January 6th, the white supremacists who rioted on the Capitol, right? You have America where people of color, Black and brown folks, our Asian brothers and sisters, indigenous people are seen less than, right? You have America where racism in America as Americans apple pie. You have I like to say about the last administration, right? You had a grifter in chief, a white supremacist chief, a Jim Crow in chief, right? That the person who occupied the office of the president, that was no president. That was a white supremacist. He was a grifter. That last administration was the biggest steal in the history of this country since the stolen lands of indigenous brothers and sisters. So I like to get respect to the Piscataway people where I am in the state of Maryland, right? And since the stolen lives of Africans who helped to build this country, right? You think about racism, it's baked into the walls of America. And you have racism in our policies, in our systems. And you cannot talk about moving forward as a country without talking about racism. You can't talk about moving forward as a country without talking about the structural violence associated with racism, the trauma associated with racism, whether it be 8 minutes and 32 seconds of a knee on the neck of George Floyd, right? The dehumanization of that. Ahmaud Arbery, Breonna Taylor, y'all know the names. There's other names I don't know all the names, but you know the names. Michael Brown, Tamir Rice, right? Elijah McClain in Colorado. This sort of report came out a few years ago that when he was confronted by police, they had no reason to confront him. The young man several weeks ago who was bringing Subway sandwiches home to his family was killed, right? The young man who was in a garage that had a cell phone and was killed. Time and time again, we're seeing people of color murdered, right? The officer in the military just found a few days ago who died. He had he had PhD, had a mental health issue, and he said, I couldn't breathe, and he died, right? So this violence against people of color, I've been railing against how we see young women of color. You saw the young girl recently who got pepper sprayed, right? The young Black girls who've been body slammed by police officers. One of our research officer recently, a few years ago, remember the barbecue when she was in her a bathing suit and body slam. Why are we abusing young Black women like that? Young women of color like that? So the over-policing, police brutality, the militarization, that's structural violence, y'all. It's structured violence. That trauma, okay? You can move to the school to prison pipeline. You know, you look at what's happened with ICE, for example, in the last administration. We put children in cages. Is that America? Is that the America that we want? To me, that's also example of racism, white supremacy, because your skin color, because looking for opportunity, but you get put in a cage. That's violence. Think about the trauma to those families, to the parents, to those children, right? So we saw what happened on January 6th, and we still are dealing with the repercussions of that. Racism is a public health issue. We have to dismantle racism. We have to dismantle white supremacy. You know, it's interesting, you know, and for many of you, it's probably the same thing. You've been fighting for environmental justice, fighting against racism. Then all of a sudden people got an epiphany. Black lives matter. The global movement for Black lives. Then all of a sudden they come to you now. You know what I'm talking about, Martha? Come to you now. Hey, how can we do these issues? Address this. Tell us how to help. I've been saying, I know y'all said this. We've been saying the same thing for years. Where you been at? That's draining, y'all. It's draining to be Don Quixote trying to fight for social justice when academia, when our institutions. Remember, this Black Lives Matter movement, this racial reckoning, this is on all sectors. Academia, environmentalism, right? Whether it be healthcare sector, right? Entertainment sector, corporations, government, you know, this reckoning, because we have this dehumanization throughout all these sectors where we're not valuing people, right? We're dehumanized folks. I mean, think about COVID-19. COVID-19 has made visible the populations of racist policies made invisible. Frontline workers, healthcare workers, restaurant workers, transit workers, right? Our service workers, our brothers and sisters who work in meatpacking facilities, right? Many are young women of color, young Black women, young Latinx women, right? Our brothers and sisters who go to the fields, who pick our fruits and vegetables. You've seen outbreaks, right? Our brothers and sisters who live on reservations, indigenous brothers and sisters, right? And we're saying like, wow, why are their rates so high? They should wash their hands. Don't we know that a lot of folks don't have access to potable water? What about our brothers and sisters that live in the colonias, right? They don't have access to sewer and water infrastructure and safe water. We have people in this country who do not have access to safe water. The US of A, okay? So think about the disparities of morbidity and mortality when it comes to COVID-19. Let's go back to that previous slide that said racism, public officials, people were wearing their coats, right? Doctors. Let's talk about healthcare. Let's talk about was it Susan Moore? The Black doctor you saw in the hospital in Indiana who had COVID-19 and said her experience was racist and she died from COVID-19. Think about those essential workers out there, disproportionately folks of color. Like my sister who's a nurse who got COVID-19, but she survived. Like my niece who worked at a restaurant, got COVID-19, but she survived. But there's 500,000 people in this country who did not survive, who didn't make it. But what about those folks after they got exposed to SARS-CoV-2 virus, right? COVID-19 disease, who recovered? There's no full recovery. Some people have long-term debilitating effects, deleterious effects from exposure to the virus. Think about the healthcare system itself and why so many people have been impacted by COVID-19. We have to think about, go back to, I said, the history of this country and racism. Think about the racial and biological exploitation of folks of color in this country. We can go beyond Tuskegee, y'all, okay? We can go beyond Henrietta Lacks, the immortal HeLa cells, right? Y'all can watch the movie, read the book in Baltimore, Maryland. You can go beyond the father gynecology. Who did he do work on to make all those advancements? On enslaved African women. Look at sterilization rates of women of color in this country, right? Look at sterilization of women, Venezuelan women, right? Recently, that came out a few years ago. We exploit, we dehumanize. The medical system's done this to folks of color. So why do we think there's so much distrust of the medical system? Why do we think there's so much distrust of research, scientific research, when we continuously fail in how we show that we value people's humanity? You look at the strain of eugenics still in our medical care system. You look at the fact that that doctor who died was because she didn't know what was happening to her. It's because of racism. Tell me something. Why do we have 3 to 4 times the rate of Black women dying in childbirth compared to white women? When the most sensitive time in your life as a woman, when you're bringing, one of the most sensitive times, when you're bringing a person into this world, a new life, a new world into existence, you're not protected. You're not coveted. The arms are not wrapped around you to protect you and that unborn child. Why is that? That's not genetics. This is across income. That's because of racism. Because Black women, hey, they have more, this myth of they can do with the pain. My spouse, when with the birth of my first child, she didn't get the epidural that she needed during the time. And it was like Keystone Cops. I was in the room, y'all. It's like, what's going on? She's in pain. My oldest is in the room, so she obviously survived, but there are a lot of women who have lost their babies, and also, as I said, who died in childbirth. So we have a reproductive justice issue too, when you think about these issues. So COVID-19 has made visible the populations our policies have made invisible. We know because of air pollution exposures, you see differential long-term exposure to PM2.5, study from Harvard showing the higher rates of morbidity and mortality for folks who live in areas with more air pollution and have morbidity and mortality differences, right? So you see those disparities. Well, we know part of the reason why. I'll hold off on that point about air pollution. but we have to really address our structural inequalities, our structural violence. We have to address systemic racism. And you can think about whether it be medical apartheid, maybe that's a harsh term, medical apartheid. You can think about food apartheid. We already knew the populations who are going to be disproportionately impacted by COVID-19. Remember, we're in a pandemic, y'all. So we have the pandemic of racism, the pandemic of COVID-19, the pandemic of toxic capitalism, the pandemic of climate change. Yes, we know about the global north and the global south. What we do is a disproportionate impact them. But what about in our country when it comes to climate change? You know about the Katrina, the 50th anniversary of Katrina last year, but we don't have to talk about Katrina in the Gulf Coast. We can talk about what's going on right now with Texans, right? With this winter storm, the big freeze in Texas, the oil and gas center of the country, and folks didn't have power. And you know those issues, the lack of power, the lack of water, the lack of food, who is going to differentially impact economically and socially vulnerable populations? And we've seen that. You saw the horrible news of people dying from carbon monoxide poisoning. You saw the horrible news of the young man who went out to play in the snow and he passed away from hypothermia. Who's going to be disproportionately impacted? You know, in California from experiences of climate change, about forest fires. What populations are not going to be able to rebound from those fires? You said the loss of life, loss of property, socially and economically vulnerable, who are disproportionately people of color, Black and brown people. You think about the history of redlining in this country, segregation. You know, communities that were redlined have more impervious surfaces. So you see higher surface temperatures. You see more urban heat islands, right? You have that in LA as well. You have that in California where you have a lot of impervious surfaces. So these heat islands. And we know temperatures are going to increase. So y'all know heat waves are hell for the poor and the elderly. We have this in the state of Maryland. We have an urban heat island effect in Baltimore. Baltimore, just a little bit if you don't know this, Baltimore was the first city in this country that had racism-based zoning. It got thrown on the Supreme Court, right? Y'all know the history of you know, housing, right? Levitt towns, racial covenants. You're a certain complexion, you cannot get this loan. If you're a certain complexion, you can't live in this neighborhood. If you're a certain complexion, you can't get access to this positive, help promoting housing infrastructure. So you look in Baltimore, you see like the impervious surfaces on the left side, and look at the surface temperature. Look at the temperature on the right side. There's this work that's shown in Baltimore, even across blocks, you can see a 16-degree temperature difference, but even on the same block, you can see differences in temperature from house to house. Why is that? Because we have on impervious surfaces, right? You're absorbing the heat, you have release the heat, right? You think about not having any tree canopy as well, right? And in these same communities, they don't have air conditioning. So remember last year was the 25th anniversary of the Chicago heat wave, but you don't have to go to 25 years ago. We're having more people dying from heat, more low wealth folks, more folks of color, because they live in communities with impervious surfaces that have been segregated, that have been redlined, that do not have trees, that do not have air conditioning. This is an environmental justice issue, and this is an issue related back to racism, related back to segregation. You also think about when you have all those impervious surfaces, it's just not a heat issue. When it rains, where does the water go? So you also have a stormwater issue. You also have a flooding issue, which leads to, in many cases, with communities that have poor sewer and water infrastructure, sewage backups. So basically be both urban heat islands and also become these stormwater islands too. And where does that water go? After a hurricane, after episodic rain event, where does that water go? Now, we talked about these pandemics, y'all, and racism, pandemic of toxic capitalism, the pandemic of climate change, the pandemic of coronavirus. You can also think about pandemic of environmental pollution. Y'all know the history of the EJ movement. I like to say that the W.B. Du Bois, and some people may disagree with this, was the great-grandfather of the EJ movement. I say Dr. King was the grandfather, but for many, Cesar Chavez, he may be the grandfather, right? We may have multiple grandfathers. We have multiple grandmothers that we don't recognize, right? You think about ecofeminism, right? And how women are actually been the leaders in the EJ movement. frontline, fence line communities. But I just want to call out a little bit Dr. King's work to look at the intersection of what environmental justice is about, Raul. You think about Dr. King's work when he was assassinated 53 years ago, right? He was talking about issues of labor and men not being treated fairly on the job and the exposures. And you see the sign that says, I am a man recognized by humanity, right? And you remember my points I made about George Floyd earlier. Think about those you've experienced these things. Walking, I like to say, as a Black man, seeing the trauma of seeing other Black men murdered. So I talk about, as a person of color, walking while Black, coupon while Black, Starbucks while Black, right? You see these instances of Black faces, being a person of color in these spaces and white, Black faces, white spaces, and not being treated well, right? Sleeping in your dorm while Black, in your house, eating ice cream while Black. You remember the guy was murdered by the police officer, or the young lady playing video games with her nephew and was murdered. You remember the instance of the young lady at the park who had a Puerto Rican flag go, and the guy told him, go back to your country. Puerto Rico, America. I'm not understanding what that means, but this xenophobia, this hate, it not being valued. You see the sign that the man is carrying, said, I'm a man. He's saying, recognize my humanity. Y'all seen the same signs people carried this past summer with the Black Lives Matter movement, right? So you think about the environmental justice movement, yes, it's a movement fighting against the disproportionate burden of these environmental hazards. And look at one of the languages. I talked about structured violence in communities of color. I'm gonna tell y'all this, and I've been really trying to be more transparent and clear and more real talk about these issues. When you permit facilities to poison communities, that's also a form of structured violence. Why are we permitting power plants, coal-fired power plants, natural gas power plants? Why are we putting pipelines? And y'all know about the oil and gas wells in LA. Whose neighborhoods are those oil and gas wells in, right? You know about the refineries in Richmond. Whose neighborhoods are those refineries disproportionately in? You can go throughout Central Valley in California. Who's been impacted by those polluters? Think about the agricultural workers and the impacts on them in California. Where they've been exposed to disproportionately, right? We know what's happening. And when we're poisoning people, right? When the laws are protecting them, that is state-sanctioned violence. It's not by accident, it's intentional in my opinion. We need to do better. The time is now. We have to do better. Think about the trauma. Again, I'm a Black man, right? I don't have to deal with the situation as an immigrant who's trying to work. That's not my experience. But I can understand what people are going through when that stress, for example, if you think about the issues around, I mentioned ICE and the caging of folks who are looking for an opportunity in this country. People who, because they may be of a certain ethnic group, right? Racial ethnic group, being targeted. And the psychosocial stress that comes along with that. That's a form of violence too. That trauma that people deal with. Think about the overlay of different types of trauma that we deal with, we carry forward with us. That's part of also the reason why people are dying prematurely. The stress of racism, the stress of hate, the stress of white supremacy, the stress of environmental racism, the stress of environmental oppression. Okay, let me slow down a little bit. Get a little heated here, Mark. I'm gonna slow down some. Could be calmed down a little bit. But it's a reason why I'm passionate about this. It's too much, y'all. We gotta do more. Y'all know the history. I'm gonna skip this slide about the EJ movement in Warren County. We have these definitions of environmental justice, and I think these definitions are fine and well, but I don't think they really, like the first definition is a bad definition. That's the EPA's definition. I call it the kumbaya definition. I'm gonna use something that's even better for y'all. It's the all lives matter definition. Of course, everybody, regardless of race, background, ethnicity, religion, etc., should be protected. But we know we're not. We know we're not. Think about Flint. All they had to do was do what? Comply with the lead and copper rule. That wouldn't happen in Ann Arbor, Michigan. But you saw recently that people got indicted. It's about time that governor got indicted, because Governor Snyder was part of the reason with the emergency management law that took the power of the vote, took the power of representation from the people. They elected people, and all of a sudden, hey, emergency management law, we're going to put an emergency manager, and we took your power away. Your democratic person you voted in, they no longer represent you. Somebody else I appointed is going to lead the way. That in itself is a problematic law. He should have been indicted. Those deaths from the water crisis, from Legionella, are on his hand. And think about this, man. Think about Flint again. The intersection of race, class, place, hazards, vulnerability, invisibility, right? Children tend to be invisible. And I'm gonna use a riff off of a person who occupied the White House, right? How are you gonna put America first, y'all? You don't put your kids first. How can we have kids been exposed to lead still in America today? There's no safe level of lead. So all those kids were exposed to lead in Flint, right? In other parts of the country, it's not only Flint, we have a lead crisis in this country. Lead in drinking water, leaded paint. People may live near smelters. Think about legacy pollution sites, right? Kids have been exposed to lead. Lead is a neurocognitive toxicant. Lead puts a cap on your potential. So you got kids being exposed to lead, and this disproportionate kids of color. You got kids being exposed to particulate matter, right? There's no safe level of lead, as there's no safe level of particulate matter. Those are two things that we can do more on, okay? Second definition is Bunyan Brown's definition of environmental justice. And I like it better because it speaks more to the social terms of health. Those of you in public health, you're gonna recognize the social terms of health. Realize your fullest potential while experiencing the isms. Y'all can read the slides. Decent pay and safe jobs. Non-health policies impact health. Quality schools and recreation. Non-health policies impact health. Decent housing and adequate health care. These are all social terms of health. Communities free of violence, drugs, and poverty. Structural poverty. Intergenerational poverty. Folks get stuck in poverty. Providing opportunity. Think about, I'm gonna go back to the FHA and the redlining. The fact that we have a wealth gap in this country between folks of color, Black and brown folks, other folks, and white folks, it can be connected to how we build wealth. One of the main ways we build wealth outside of Reddit and GameStop, I'm not sure if y'all into that, outside of Reddit and GameStop, is the home ownership, right? And if you, because your skin color, are not able to get a loan to buy a house, you can't build that equity, how are you gonna get wealth in this country? So the home ownership rates, differential home ownership rates are an indicator of why we have differential rates of wealth. So you look at the wealth gap, the income gap, well, really the wealth gap can be connected to home ownership. But Bunyan Brown's definition, cultural diversity is important too, not just biological diversity. What he's saying is people are important. So environmental justice, y'all, it's comprehensive movement, right? It's a movement against all these hazards, but it's a movement for community. It's a movement for public health. It's an economic justice movement. It's a public health justice movement, right? Environmental justice is about where we live, where we work, where we play, where we pray, where we learn. Environmental justice is proximal, it's everyday, it's pocketbook. So y'all know this history. I'm gonna skip this, I got some other slides to get to. So you think about, this is how we frame EJ, right? Overburdened by hazards. That's the traditional frame. But it's more than that. It's the lack of enforcement of laws and regulations. And I've been going back and forth on this issue. If we comply with every law and regulation to the fullest, we would have no environmental injustice. I say that, but I have to say at the same time, there's some gaps in our laws and regulations. If we comply with Title VI, right? Y'all know about the EPA and administrative complaints maybe, and that the EPA never determined an instance of environmental discrimination, which is crazy. I gave you examples. Y'all got examples in California, examples in San Diego. You got examples in Oakland, right? You got examples of Richmond. You got examples throughout California. You can say that looks like environmental discrimination to me. So what's wrong with that, right? Also, you said communities, getting back to Bunyan Brown's definition, overburdened by psychosocial stress, as I mentioned before, that's stress, right? The weathering, get on your skin. Y'all know Geronimus, those of you in public health, or those of you in medical, system, population health. And then these communities that don't have access to amenities, like infrastructure, right? Built amenities, social amenities, ecological amenities, parks and green space. You think about the huge park movement that you have in LA, and who is behind that? one of our, of course, EJ, who recently passed away, right? Not having access to parks. What it means we don't have access to tree canopy. Trees are good for what? Heat mitigation, air pollution mitigation, noise mitigation, right? Stormwater management. Trees are good for food, right? Trees are good for playability. Trees are good for mental health. Trees are good for property values. Trees are essential components of a healthy community ecosystem. If you don't have trees, you don't have life. Access to grocery stores and supermarkets. Instead of having those positive things, you got more, and y'all know I'm talking about the clustering of fast food restaurants, overabundance, right? In communities of color, Black and brown communities. You got more pawn shops, liquor stores, payday lenders. They all cluster together. That's pathogenic infrastructure. So about pollution exposures. Now I talked about particulate matter, a little bit. Talked about lead, PAHs, and think about the health disparities associated with those exposures. Asthma, birth defects, reproductive issues, right? Cancer. And so these we have a difference of burden in these facilities. Think about the whole issue around cumulative impacts, right? And you have exposure disparities that leads to risk disparities, which leads to these health disparities, or from the statistically health disparities, but you have to think about from the social justice perspective, we're talking about health inequities, right? Talking about that structural balance, talking about structural racism, okay? Race plays a role in, this pollution advantage. So whites have a pollution advantage and folks of color are at a pollution disadvantage. We're not producing the pollutants in the same way that our white counterparts are. And this is a endemic. Talk about particulate matter again. PM is a public health issue. Particulate matter is an EJ issue. Y'all know it's dust in the air, right? That dust, those small particles can do what? Cause asthma attacks, increase your blood pressure, lead to stroke, lead to heart disease, right? Increase diabetes, lead to Alzheimer's, lead to birth defects, increase infant mortality rates, right? Low birth weight births, lead to cancer, of course, okay? Premature mortality, and reduce life expectancy. And let's talk about the syndemic again. Did y'all see recently, they're trying to change the subject a little bit, that I believe that African Americans in this country, life expectancy went down by 2.7 years? Not just coronavirus, y'all. Think about 4 years of a white supremacist in office. White supremacists. Yeah, I mean, of course it's obvious. I just keep saying, I know. White supremacists in office. 4 years of anti-science policies. 4 years of anti-public health policies. 4 years of policies that are xenophobic. 4 years of policies that are anti-immigrant. 4 years of policies that really were about dehumanizing, traumatizing people of color. That would make your life expectancy go down. And then you add on the pandemic, and you add on the economic crisis associated with the pandemic, the coronavirus pandemic. So this is a syndemic. So this syndemic is killing folks of color. So we got to look at the intersections, right? I'm talking about intersectionality. We got to look at the upstream determinants. We have to make sure that when you think about medical care and healthcare and public health, remember y'all that Caduceus staff has two snakes. Public health snake, and a medical snake. Okay? We got to invest in both. It's like, public health gets no love, but all of a sudden, where's public health at? Well, what happens is you kept cutting down the budget. Environmental public health tracking programs got removed. We remember after the housing crisis a few years ago, we lost 55,000 people from the public health workforce. Those folks weren't replaced. But we had to have the healthcare system working in tandem, having synergy, having congruency, harmonizing with public health. And we haven't done that well in this country. And you see the results of 40% of the people who died from the coronavirus, those deaths are preventable. Partly because, again, white supremacists, I know it's obvious, I keep saying it, in the office. But the policies, the anti-health policies, the anti-public health policies were part of that. So you think about air pollution again. It impacts your health across the life course. Air pollution is killing people. So when we think about the coronavirus again, long-term exposure to PM increases, morbidity and mortality rates. Why is that? Well, you have people being exposed to air pollution who have comorbid conditions, right? Have underlying health issues. But also, as you know, what does air pollution do when you're exposed to it chronically? Does it reduce your lung capacity? Because your lungs have been damaged by PM. It scars your alveoli, right? Your lung sacs. It probably does something to your heart, too, your cardiovascular system, reduces your capacity. And then you have the SARS-CoV-2 virus comes in and takes advantage of that to reduce capacity. So it increases your morbidity and your mortality risk, right? So if we're going to address this pandemic and future pandemics, we have to make sure that we address air pollution. We have to address traffic-related air pollution. You know it well in LA, the highways and byways of LA. We have to, and we know whose communities are disproportionately hosting those highways and byways, right? We have to do something about mass transit. We have to electrify our systems. We have to have electrification. We have to have equity and access to charging infrastructure. But by doing that, I think that's a part of the solution. We have to electrify our ports. We have to electrify our goods movement activities, our big drayage vehicles, our diesel trucks, right? Think about, again, Port of San Diego, Port of Oakland. I think they're making progress in some ways, and y'all can speak to that better than I can. I'm doing some work in Savannah and Charleston around goods movement issues, but that's a big source of air pollution that disproportionately impacts communities of color. So I think electrification can be a public health solution. I would frame it as such. So what can we do? We need to, I think, get back, I say not get back to, but really hold on to and try to embody and actualize the 17 principles of environmental justice. And the 17 principles were basically developed at the First People Color Summit. The anniversary of the First People Color Summit is this year. I believe it will be October of this year, 30th anniversary of the First People Color Summit.
Yeah, I think it is.
Live by, y'all. When I think about these principles, we're talking about Mother Earth. We're talking about conservation. We're talking about sustainability. But what else? We're talking about human rights. We're talking about indigenous rights, right? We're talking about civil rights. We're talking about being against nuclear war. We're talking about being against nuclear power. We're talking about occupational justice, right? We're talking about self-determination of people. So it's very holistic. These principles are very holistic. And I think these are things to hold on to and to live by as individuals, and also with our organizations and our partnerships, right? I mean, look at the principle of talking about rebuilding our cities, principle 12, and protect the mother. We have to prioritize how we live. We have to change our lifestyles, y'all. We have to move away from the consumerism and capitalism. Remember I said toxic capitalism is part of the problem? Our consumerism plus toxic capitalism is part of the problem. We have to change our behaviors and lifestyles in addition to changing the system of capitalism, okay? I do a lot of community-engaged research, okay? I try to engage communities in research. It's not all about research. I mean, I tell people all the time, anybody could be a scientist. I want y'all to take this and take this to heart. Anybody could be a scientist. You don't have to have a PhD to be a scientist. And that's a big lie. I'm sorry, that's a big lie. That's more about power and control. Remember I said all these sectors are going through reckoning, racial reckoning? Academia, the scientific research industrial complex in this country also needs to go through a reckoning. We need to make sure that communities are driving the research. Think about the work that's happening. University of Southern California is doing a lot of work through that. Jill Johnson, I think, is doing a lot of work with communities, right? You got PSR, y'all doing work with communities. Think about Margaret Gordon with Oakland Environmental Indicators Project. You got CBE. You got a lot of groups in California who are doing work with communities, who are doing community-driven research. To me, community-based research is what I like to do. But to me, the gold standard for what we do should be community-driven research. Other community, for the community, and by the community, okay? CPPR, community members are the contextual experts. I live in the city of Bowie. Bowie is like a wealthy Black community, right? I don't have EJ issues. I live like in a food oasis. I'm not dealing with food deserts, food swamps, and food apartheid, right? So the folks who on the front line, the fence line, they had a contextual knowledge. In Bayesian terms, we call that specificatory knowledge. I have general knowledge. I know a lot about a lot of stuff. I got a lot of useless knowledge too, by the way. That's what I'm talking about, my oldest. But when you think about people who live on the front line fence line, they're living with it. They had a contextual expertise. We have to uplift their contextual expertise. One of my community mentors who does a lot of work in EJ, Dr. Mills McLean, y'all may know her in Savannah, she said, Jacoby, we are the subject matter experts. So let them, the subject matter experts, lead the way in developing the research questions, in developing the study design, in helping develop the methods for collecting the data, helping to collect the data, right? That's important. Disseminating data and translating the data to action. These things are important. And I just want to keep on this part about the philosophy of science that I have. And I think it's important for everybody here, particularly those of you who are scientists or who use scientific methods. Science is not an end, it's a means to the end. The end should be improving water quality, improving air quality, hazard reduction, exposure reduction, right? Improving public health, improving community health, eliminate health inequities, right? We have a lot of science that looks at what's wrong with you, not what's right with you. We got a lot of science that's about science is about extraction and not about action, right? We got a lot of science that's helicopter science. We got a lot of science that's really about studying the problem. Let me tell y'all something. It's macabre to be doing science when people are suffering, when people are dealing with structured violence, when people are dealing with trauma. Oh, Jacoby, it's not my job to translate science to action. No, you choose to do that. Now, I may not live in the EJ community now, but I came from one in Mississippi. I lived near a sewage treatment plant. I lived near a landfill. I lived near a major highway. Grew up dealing with poverty, okay? I don't have a choice to do science that's about action, do science that's about the people, do science that's for social justice, right? So when Boyer talks about the 5 dimensions of science in academia, in the Western science, he's talking about we just can't do discovery science, y'all. We overemphasize discovery science, particularly in academia. You know, publish or perish, 10 promotion. 10 promotion is about putting change in your pocket. That's not about social change. And I can say that now because I'm an editor-in-chief of a journal. I'm an editor-in-chief of environmental justice. I think it's great, but I know peer-reviewed publications does not science communication make. If you're gonna communicate science and have impact today, y'all, okay, PSR, okay, people on this, listen to me right now, you gotta be doing briefs, you gotta be doing infographics, you gotta be doing white papers, you gotta be creating maps, you gotta be doing tweets, you gotta be doing Instagram, you gotta be doing Facebook, you gotta be TikToking, you gotta be on the radio doing telenovelas, right? You think about cultural competency when it comes to science communication. You gotta do science communication in the ways that people get it. Your peer-reviewed publication is not your elevator speech. What's your 15 to 30-second elevator speech that's gonna get in the hands of that frontline fence, a community member, is gonna get in the hand of that policymaker? That's science communication. That's science communication, and that's about action. And that's about putting change for the people and not just changing your pocket. So Boy's talking about we gotta do engagement science. We gotta do science of teaching. We have to do interdisciplinary science. We gotta do action science. And I tell my colleagues and students, if you're not doing all 5 dimensions of science, you're doing incomplete science. That's real talk, y'all. We don't need more science that just studies the problem. We don't need more science that's reductionist. We need science that's more like salutogenesis, Antonovsky. Science is about promoting health and wellness and well-being, promoting assets and strengths, talk about resiliency, and not what's wrong with folks, okay? That's the power of science. So for me, I do science that serves the people. That's the science that I do. And that's the science I think more of us want to do. And think about those of folks who go to get PhDs, who are going to medical school, and you go there. Why you go there? Because you see a problem maybe in your community. You want to go back and solve that problem. But a lot of times in science, they said, no, that's not been objective. I think that's the most objective, because your objective is actually solve problems, to seek action, to eliminate inequities, not to study people's suffering, not to study people's trauma, not to study the structural violence. I mean, that's macabre. I'm sorry, that's macabre. I don't want to keep on that point. Let me keep it moving. I got a lot of slides to get through. So we're doing this work And Martha, how am I looking on time? I have 50 minutes. Well, I got 5 minutes left or 10 minutes left.
10.
Okay, I got like 35 more slides. Probably more, but I won't cover them all, Martha. I have a bad habit of getting inside my head, but let me speed it up a little bit. So we do this work with communities, y'all. We got to think about the issues, impacts, opportunities, benefits, and partnerships, right? It's two hands of engagement, okay? And think about science, right? Everybody's a scientist. We're using science right now. On Zoom, we're using science. We watch science, we turn on science, we wear science, we breathe science, we eat science, we drive science, we wear science, right? I mean, I've already said that one. You are an applied scientist. You get what I'm saying? You're applying science. We got to connect science back to the people. We got to make science, like I said, by environmental justice, proximate and pocketbook. We got to bring science to the people. Let them know you already are scientists. You're already using science, right? And so think about what work you do connected to food, faith, family, health, and jobs. That's making a pocketbook. That's making the work we do every day. That's how you, even when you talk about climate change, oh, doom and gloom, you know, the world's gonna end. I'm sorry, that message is not good for frontline physical communities. They've already been dumped on, already been used in sacrifice zones. You gotta talk about the climate economy. You gotta talk about opportunity, right? You gotta talk about a vision for change. You gotta talk about hope. So how can you talk about climate change, the little c in climate change, and make it real for folks, but connect climate change, talk about these issues of racism, connected to how we overcome dismantling food, faith, family, health, and jobs, okay? Citizen science, community science. I'm on the board of the Citizen Science Association. There's been a lot of discussion about we gotta change our name. I know we're gonna change our name, but citizen science in the US context is not an inclusive term. Public science is a better term, right? Participant science is a better term. But citizen science, I'll just use it for now, is a way to democratize science and access to tools and research, right? Think about traditional bird watching, water quality monitoring. I think it's a way to empower citizens, empower residents through this kind of, this type of science. Empower is not spelled wrong, y'all. It's the idea is, I can't give people power. The idea is, how can we use science and these tools to to help people connect the power they already have, to build that power, to grow their power, to actualize that power. That is empowerment, okay? That's how to build the people up, build the community up, build capacity to address these issues. Here's a slide that shows some tools that may be of interest to y'all. One thing I wanna say, and y'all know this very well in California, we build tools. My lab does these geospatial tools that map environmental justice, like Maryland EJ Screen. You have Powell Environmental Screen, which is probably the best tool out there right now. I just heard today that version 4 has been released soon. Is that right? Do y'all know that? I think version 4 has been released either this week or next week.
Today. I think it was today.
Oh, today. So I got okay, today then. Okay, cool. So I think your version 4 is gonna be way better than our version 1. So it's like we gotta catch up with the California.
Eliminated race because we suck.
Oh, okay. But these tools I think are really useful for mapping injustice, also targeting resources. You heard the whole 40% rule for the Biden administration. When I hear, I think about 40 acres of mule that Black folks didn't get. So are you telling me we can get a 40 acres of mule family? But I think that 40%, how are we going to invest that? You can use tools like Kyle Environmental Screen, okay? Who are the communities that have the most need? So we have these mapping tools. I can talk more. I don't want to talk more. I can talk more about that later. But one of the things I want to get to, we also are mapping park access. And I think that's something that'd be really useful for those of you in California, beyond the Kyle Environmental Screen, to mark your tree canopy and your park access, your green space access. I'm not sure you have a mapping tool like that, but I think that's a really important resource when it comes to climate change, right? So just more slides on that. When you think about these issues of justice and sustainability, we got to move away from unjust housing to just housing, unjust transit to just transit, right? Unjust food infrastructure. We saw what's happened with COVID-19, right? To just food infrastructure. Unjust healthcare, y'all, to just healthcare, okay? Unjust schools to just schools. We saw that with COVID-19, not just the school divide, but the Wi-Fi divide, y'all. We have children who may be a couple years behind, almost like hopefully not a lost generation when it comes to, because of COVID-19, right? So justice equity has to be baked into how we do sustainability. Sustainability doesn't have equity and justice, to me, is superficial. You got to talk about equitable development and the equitable development framework when you're doing redevelopment, when you're trying to revitalize neighborhoods, which is a weird term, revitalize them, and then you revitalize them so much that the people of color disappear. Wow, right? The people of color get so revitalized that they have to move, because that's really gentrification. Whether it be environmental gentrification, green gentrification, or climate gentrification, y'all know what I'm talking about. After these disasters, the people who were living there were already socially, economically vulnerable, who tend to look like people of color, you know, like Dr. Bullitt says, they didn't have a complexion for protection. For some reason, they're not able to return home after these disasters. So I talk about how can we build environmental benefits districts. So we map these communities and we say, okay, we want to put in these districts and make sure we have equitable development principles on the front end so we don't gentrify on the back end. You have to have intentionality when it comes to making sure everyone benefits from redevelopment and revitalization. And so your green zones program in California, I'm not sure how well it's going with the evaluation of it. Y'all can maybe tell me that, but I see this as a model possibly for doing this well, but y'all may have a different perspective on that. But I would check out the green zones program and seeing how, again, Cal Environmental Screen is a way to, you know, map where your green zone should go. And then you see, I know you got the climate gap funds and the cap and trade proceeds. I know we don't like that as EJ folks, but are those dollars going with the communities that need it? Or are those, is that program providing more damage? And I know you had a big part in that, a different administrator becoming an EPA administrator because of that program. So I'll keep it moving from there, sorry. So just a few more examples. I'm gonna be quick about this. I have way too many slides. So for the students who are on this in the audience, you can have impact now as a student. You don't have to wait till you graduate, right? So I did work in North Carolina. I went to UNC Chapel Hill, Tar Hills. These post-slavery Black communities that didn't have sewer and water infrastructure. The sewer and water lines they went through their neighborhoods, they weren't connected. But at the same time, they hosted sewage treatment plant. So they didn't have what we call basic amenities, not having sewer and water lines. These were what we call pre-New Deal communities. The roads weren't paved, right? They didn't have ingress and egress, right? Not good access. They didn't have gutters, like the basic building blocks of neighborhoods, they didn't have them. And so we did some work with Omega Wilson and the Western Revitalization Association. They came up with a framework called community owned and managed research. They were dealing with systemic long-term racism, y'all. These were post-slavery neighborhoods, freedmen's neighborhoods, right? But they were excluded from the community amendment, excluded from infrastructure because of racism. And so they developed this community owned and managed research framework to look at these issues around well water quality and septic system quality. They found rates of failure. They found microbes above maximum contaminant levels in the well water samples. And so I did this back in 2000. So this community owned and managed research framework has been around for 20 years. So it's really about science for compliance, not just doing research for research sake, but doing research are you in compliance with the Clean Water Act? Are you in compliance with Title VI of Civil Rights Act? Are you in compliance with building codes? That's what communities need. Let me just say this. We don't have to get into the epi trap, y'all. Well, you got to show Dr. Wilson, we got to prove that this exposure is leading to this disease rate that we see. Y'all know it's kind of impossible to show because of all the pollutants our communities exposed to, that this pollutant A led to disease B. That's the epi trap. So let's look at, on the left side of that environmental health paradigm, look at exposure and exposure differentials, and are you in compliance with the law? Are there gaps in the law? I think you have more power there. That's just I want to share that. We stopped the Highway for Men built. We got people sewer and water infrastructure for the first time. So I did this as a grad student, okay? Uniontown, Alabama. It's a community in Uniontown. This Uniontown is 20 miles near Selma, Alabama, right? Just real quickly, Uniontown is unincorporated. So you may have this in California. These communities that don't have a town mayor, don't have a town council. I call it contamination without representation. These are communities that end up becoming the dumping grounds for the industrial corridors. Or we got waste management projects, let's build a new landfill. Look, we got this community out here because they don't have any voice. Remember environmental justice, your economic power equates to political power. But if you are unincorporated, that means you have no representation. So you're one of the most politically disenfranchised areas, then becomes kind of environmentally disenfranchised because of that lack of representation, the lack of voice. That first picture up top is a mountain. It's not a real mountain. It has 4 million tons of coal ash. They take in trash from, I think, 36 states in the country, plus they can accept coal ash, right? The landfill, the Arrowhead landfill, was built on top of an old plantation cemetery. You see the bottom picture. So they don't care about your living, when you're Black, when you're Latinx, they don't care about your living, and we don't care about your dead, okay? And then they got a cheese plant and they spray cheese waste. They have a catfish ponds and catfish factory. Now that cheese waste, cheese effluent, right? They spray it on the ground. Is that cheese waste? No. When you flush your toilet, in many cases, your waste goes to a sewage treatment plant. When they flush their toilet, their waste goes to a containment pond. And they spray human waste on the ground. That's human waste that you're seeing. Okay? This is a systemic racism, y'all. This community is what? Unincorporated. Okay? Been working with BBC, Black Belts, work for justice for about 2 years to do monitoring, hyperlocal air quality monitoring, and helping build capacity to try to fight back against this landfill and these other environmental insults. I'm gonna skip this example because there's too many slides, and I'm gonna close out with this example. Also done some work in Curtis Bay in Baltimore. It's a very similar to some of what we see in California with port communities. So the port of Baltimore, right? And they have a lot of goods movement activities. Ships come in, cargo traffic, intermodal vehicles, take the goods off, put it on rail, put it in the trucks, take it to warehouses, right? So a lot of pollution associated with those activities. And also there ends up being other types of uses. When you have a port, they end up dumping a lot of the other super pollutants there. The coal-fired power plants, they have a medical waste incinerator, they have a trash incinerator, Willoughby incinerator in this one community. So think about all the pollutants that have been impacted, exposed to, right? Then also the economic disparities. This community is low wealth. Look at the household income, median household income compared to the rest of Maryland in the country. Half, y'all. So structural poverty. Your economic power equates to political power. Also health disparities. Look at the mortality differences, right? For this area compared to the city of Baltimore and in the state and the country. You see the connections. At one point in time, this is the most toxic zip code in the country for air pollution emissions based on TRI. Look at the zip codes across the country. So think about all these air pollutants, not just impacts on respiratory health, but also cardiovascular health. The mutagens that they're exposed to, right? Reproductive toxicants, neurological toxicants, right? And then just want to end here, like the power of one person. This young lady, Destiny Watford, who actually now lives in California. I was on the panel or something earlier. She was she was doing the panel about her community earlier, this film festival. But she, as a high school student, organized her community to stop a new incinerator called Energy Answers from being built in her community. Okay. And so I just want to share the power of one person. She won the Goldman Prize for North America in 2016 for her work as a high school student in stopping this incinerator. So she was able to show that you can stop systemic racism. They were going to put this incinerator less than 1 mile away from her high school. And you see me in this photo doing some things. So I want to close here to say that we have to work together to address systemic racism. All right, slides. Get to my last slide. Sorry, too many slides. We have to work together to stop systemic racism. And I think the EJ movement is the key to that, but it's really the human rights movement that we have to be engaged in. So we have to have more people in the tent working together to address these health issues and to really address this endemic that are impacting a lot of Black, Indigenous people of color across this country. So thank you.
Thank you, Dr. Wilson. That was an amazing presentation. Thank you for keeping it 100% real with us. I know the people in this webinar, the attendees, really enjoyed it from their comments and the discussions that they were having in there. So thank you all for staying engaged in the chat section as well. I want to, before we move on to the Q&A, I want to just, Martha, if there's anything that you want to say before we, go on start with the Q&A. Also, everybody, please use the Q&A chat box to ask your questions. Those of you who are tuning in on Facebook, please use the the chat, the comment section on Facebook. Martha.
So yes, I have so many different reactions, and I don't even know where to start, but I will say this, and I think Jacoby, you said it, that yes, we have to do this work, and it's important for people to remember that white supremacy expresses itself in ugly events, like we saw in Washington, and the killing of Black and brown people. But it's also recreated and reproduced every day with simple and small acts of our unconsciousness. And that's one part, right? And so this idea that none of us have a racist bone in our bodies, these things are wrong. We ingest and inhale and breathe the racism, and it's rebuilt every day with systematic practices. And I think that that's sometimes hard for people to hold and sit with. And then I want to say that as part of our job as healers is to also understand the historical trauma that comes from experiencing it. And I would venture to say that there's deep historical trauma with being a perpetrator, even if it's in your small unconscious acts. And those are the hard things that we have to hold and dismantle. And so with that, I'll stop and have folks ask questions.
Great comments.
Thank you, Martha. So we're going to kick off the Q&A session with some questions that we have come up with at PSRLA. Jasmine, if you can just post them on the screen for us. So the first question is, so we are a health-based, membership-based organization, or a health professional-based organization. So we really want to know, what can health professionals do to dismantle the implicit bias practices within medicine? Like, where is a good place to start? You sort of mentioned reproductive health, and really, and even within medical schools, I was speaking to a few residents, and they were telling me how just the backbone of the teachings were kind of rooted in racism, and they were pretty racist. So where can health professionals start to begin dismantling the implicit biases that they're kind of taught? And
oh no, I think that's a very important question. I think just like in the same way in academia, as we train folks to get, master's degrees and PhDs, we have to have anti-racism built into our training and curriculum. We have to do the same thing, building anti-racism into the medical school curriculum, right? Mm-hmm. And I think, I actually have 3 siblings. They're not doctors. I'm not saying this bad thing. 3 siblings are nurses, right? And so, just the experiences that they've heard about that they have, right? That's been with their fellow professionals, and so not just the treatment of the patients, but also treatment of fellow professionals, mm-hmm. right? And so you got this rankism in academia, right? Mm-hmm. You got rankism in the medical system too, and so that rankism and that privilege and elitism is polluting it too. So there's a whole power control issue that we have to address across multiple sectors. But I think we have to have implicit bias training, anti-racism training that's baked into the curriculum. But this is the thing, y'all. I will say this. I just had a conversation with my director of my unit the other day as part of our faculty meetings. And we're talking about changing team promotion guidelines and bringing more anti-racism in, and how some faculty were a little slow on the get-go. I said already. So we had this uprising against Black Lives, this killing of Black folks and brown folks this summer, Black Lives Matter movement. Is the window closing already? Are people tired and done already? No, y'all. We have to be aware and wary of that. We have to make sure that we're holding folks accountable now. So that implicit bias training, getting this in the curriculum, and having these conversations, and also practice and working in different clinical settings, and making sure that we are just not talking about the patient, but understanding the whole patient, right? Where they come from, what community. Doctors have to prescribe more than just medicine. They got to prescribe social justice. They got to be aware aware of their patient population, what they're going through, because it may not be the medical intervention they need for the traditionally, it may be an intervention of the understand the social context, right? And understanding like maybe doctors need to be using Californian viral screen to know where their patients are coming from. Oh, so you don't have parks and green space. Man, I advocate for you to go to this park, or say, hey, maybe doctors, particularly those who've got public health degrees and doing policy health, and maybe I'm going beyond the question a little bit, right? But to really understand how, I think when you humanize your patients and you understand the concepts they come from, I think that also, as Martha said, can kind of break down some of those everyday biases that we kind of have, because we haven't humanized people, we haven't connected to them. So knowing where they're coming from and what they're going through will help have doctors have more empathize with their patients and maybe be able to provide better care, because there's a whole body, whole community approach to care. So I think that's another positive way, not just to say about the training, but a positive way for doctors to move forward. And actually, as Martha said, improving themselves while they also improve the health of their patients.
Yes, I agree. Thank you.
We have I think Jen has I want to call in Jen. She has a question.
Yes, Jen, I believe you're unmuted now, and you can speak.
Can you hear me?
Yes.
Okay. No, it wasn't a question. It was actually a comment about implicit bias. So California passed a bill in 2019, SB S44. It was called the Dignity in Pregnancy and Childbirth Act, which required that all folks who are working in the perinatal world get implicit bias training. I cannot tell you who fought harder. Was it the private health industry? You know, the hospitals were like, oh, we can't afford to pay for implicit bias training. And they opted out with the pandemic. Right? Because they were like, implicit bias training was meant to be done in person. It wasn't meant to be done via a Zoom screen where you can hide behind the screen, right? But hospitals and private insurance companies were really upset that they had to pay for implicit bias training. And you already, shared the statistics around maternal and infant death and morbidity for Black folks. So it was absolutely needed, and it still is. And that's what I wanted to say. Yes, implicit bias training is good. And for me, it was about anti-Black racism training also. But yeah, the racism is ingrained, embedded, totally integrated into the systems.
Yeah. Well, thank you for that. No, we can't wait till they become doctors. It's the same thing with people in research. I don't say it's too late. It doesn't mean you can't reform people, but it's inefficient actually. It's inefficient to wait till people become doctors. You got to get them early in training. Same we talk about in academia, where students in master's degrees and PhD programs. You got to get them early. You got to get people in undergrad. You got to get people in those pre-med programs. Okay, those post-bac programs, the med prep programs. You know the programs I'm talking about before they go, as they get through the pre-med, they do a little summer to get prepared for the MCAT. They got to get in those programs too. Workforce development perspective to the medical system, and bringing this implicit bias and anti-racism training early and often, and repeat it and be consistent with it.
Yes, there's a question that came in through the Q&A, and they're wondering, are there studies that in how effective these implicit bias trainings are in changing medical practices?
No, I cannot answer that question. I think maybe that's a question for Martha.
You know what? I don't know. And I don't know that they're effective. I don't know if Jen is saying kindergarten. I'm like, they're starting kindergarten. I don't know that they're effective. This is what worries me. We have a capitalistic system right now with the racial reckoning. People are providing diversity and inclusion training as a business opportunity.
Yeah.
And so are quickly slapping things together with no concept of, this is not a class. This is a commitment to shifting the culture.
Yeah.
Right. This is a commitment to to, you know, restorative justice, to finding new ways of engaging. And it's, you know, so I don't know. There probably is, but I don't know the literature.
I would say, I don't know the literature, but I would say another resource for doctors and those of you in the healthcare system. What about AMA? Aren't they doing a lot of work in this area? And they aren't they a leader that you can look to as relates to these issues of anti-racism training and anti-racism efforts in dealing with health inequities?
Look, you know, we just had the most bizarre conversation with the head of the LA County Medical Association, who did not know that the statue that's in their office as you come in of their founder was actually a white supremacist and the founder of a medical school, and he didn't know this history, right? And he's Latino, and he's like, what? And then and I just felt like, how would you work with him who's has some light skin privilege, even as a Latino? And so he, you know, there's lots of stuff to unpack in that, you know?
Yeah, I mean, I think with that, and that speaks to, I'll do a corollary or looking at it in academia. We do have to work to educate the deans and chairs. So I would say that in head leadership position, he's kind of like a dean and chair, right? Of a school of public health or a chair of a department. If you get the right person in and get them to understand these issues, then they can provide the leadership and also lead to the trickle down and impacting the culture within that organization. So, I mean, I don't have the answers to this, but I think there's a lot of work that we need to do. But Martha, you are right. If you don't have the right kind of evaluation and quality program, it could be a money grab, and then we can leave an entity that got the training where it creates more confusion and more stress, and not lead to really the progress that we want to get.
Yeah, thank you. I think in respect to time, maybe we should move to the next question. I know that there was a couple of questions related to implicit bias. And we'll come back to that if we have a bit more time, but I do have some other questions that and other topics that we should also cover. Jazz, if you can go to the next slide. So I know you mentioned citizen scientists earlier in your presentation. So, and you've also covered what that means, so you don't have to explain that now, but how can we use our voice and our power to create systemic change through citizen scientistship? And I also know that you don't really like that word and you prefer.
Oh no, it's just an interesting. There's a lot of discussions because of status issues, citizenship issues. It's not, in a sense, been inclusive. Yes, there's a caller. Yes. So a lot of people, Paul, are saying like community science. But then some people are trying to grab on the community science, and it means something different. So we can't throw everything into community science, because community science to me is more that community-driven science. And sometimes you say it's community-based science, but it's not community-driven science, right? So we got to be careful about the terms. But I like the term public science to be like the umbrella where these different things can fall in that, in that bucket. But Paula, I am a big fan of community science. So my mentor, Omega Wilson, I mentioned before, he used the term community science. My folks that work in Charleston and Dr. McLean, they all use the term community science, but I mean in a very specific way, from the community, of the community, and by the community. And that's what's important to this question right now. It's really about making sure science has been done by the people and for the people. And by doing, in my opinion, if we resituated science where it was to serve people, instead of exploiting people, scientific colonialism, right? I think we would have more impact. And I also would offer that you wouldn't have the erosion in the trust in science under this past administration. And you also would have seen more trust in science from folks of color with the vaccine, right? Yeah. Because we would have been doing science to serve people and not science that exploits people, right? And so I think this community science, citizen science, this crowd science, street science, the reason why it's so powerful it's democratizing science. Remember I said before, you don't have to be a PhD, have a PhD, be a scientist, or have an MD, be a scientist. Because it gets back to that point I made earlier to a question, response to a question about elitism and rankism. And really, y'all, it gets drills down to, let me be more succinct and clear, more cogent maybe. It gets down to power and control again. Whose questions counts? Whose knowledge counts? Who says that this data is valid or rigorous or objective? It's all about power and control. So I think community science is putting power and control in the hands of those who are most impacted and most affected. And just to, let me just speed up my response. One quick example is, think about our EPA monitor network for air pollution, right? Y'all know this, I think, pretty well, that we don't have enough monitors in areas that are hotspots for pollution. And so from a scientific perspective, when you have a monitor that's 20 miles down the road and sends 5 micrograms per meter cube is the daily measurement, that's not necessarily what's happening in my house. In environmental health science, we call the exposure misclassification. To say it more succinctly, that's bad science, which leads to bad policy. So as community scientists, you have to be doing your own air quality monitoring, which is really problematic for everyone. I'm gonna say this, we're being dumped on, right? And then you gotta do your own science too. It's very draining, right? It's very stressful. But to make a democracy work, it takes work. And this is actually, unfortunately, part of the work we have to do when it comes to pollution and this poison that people are experiencing, to be able to fight back. So I think community science is a big key to that, to lead to real change and making sure the decision makers are using data that's more granular, that's more spatially relevant, right? That's more hyper-local, that's more about what's happening in your neighborhood. And a lot of that data that's out there right now is not really reflecting what's happening at the neighborhood level. So you have to do that work yourself, unfortunately, until we get more of a greater coverage of monitors out there.
Thank you. I don't see any questions related to this topic, so we can move on to the next one. Thank you for your comments in the chat. So I guess the last part of this question, I believe you addressed the biggest challenges in creating healthy communities throughout your presentation.
It's the syndemic.
Yeah, exactly. Yeah. And towards the end, you talked about how we need to work together to overcome them. So how do we do that? What does that look like?
Yeah, I think what's really important, I think community organizing is a key, and being able to understand our shared experiences. I mean, one of the things I say about the environmental justice movement, it's a movement that's about hope, love, family, and our shared humanity. We have to see someone else, see ourselves in other people. So that's why I talked about before the 2 hands of engagement. How do we connect to other communities, other people who may not look like us, may not have the same religion that we do, may not have the same language, may not have the same country of origin that we do. There's some things that connect us, right? There's the need for clean air and clean water, the need for basic amenities, the need for food. Our faiths connect us. I mean, even we may have different faith traditions, but that connects us. You know, the want to have healthy communities, want to have a healthy family, good economic opportunities, right? And equal opportunity for everyone, right? I think those things connect us. Our belief in fairness, fair play, hopefully that connects us, right? So being able to bridge across difference. And that's why I think the EJ movement is a really powerful frame, because we can bridge across difference. You look at the Sunrise movement, all these young folks. I was so proud this past summer with all the young people who came out from different backgrounds for, fight for Black lives in this country. We have to bridge the educational divide, bridge this the racial divide, bridge the age divide. And I think we do that, but understanding like we are basically the same, and we want the same things. And I think that focus of having love at I know it sounds corny maybe, but having love at the center of what we do, I think this is a way to bring us together better, to overcome these challenges. Because the environmental justice movement is a movement about love. I mean, think about Martha and all y'all who fight for social justice, environmental justice. This could be a lifelong pursuit for all of us, right? It's about loving your community, loving your family that you're here, right? That you're doing all this work.
Yes, absolutely. The fight for justice stems from a place of deep, deep love for your community and our planet. You're absolutely right. All right, I think we have one more question on the next slide. I know we're running out of time, and I appreciate you all sticking with us. So, well, actually we have two more. One more for you, Dr. Wilson, and the other one is for our participants. But what is the best resource for people who want to dig deeper and dive deeper into this?
You talking about it for environmental justice or?
Well, I guess, you know, systemic racism or environmental justice is deeply rooted in systemic racism. So just learning more about that. I know that there were folks that were interested in learning more about implicit bias.
Yeah, I think so the American Public Health Association had a series on racial equity, a webinar series. They have a lot of topics that I think that'll be a place to kind of get into some of these topics around implicit bias, anti-racism, public health inequities, environmental justice. I did one last year with some folks on environmental justice. That could be a place to go. I think when you look at, I thought that AMA, you know, is another resource, I believe, for you to go to. A lot of leadership has been out there in the front about some of these issues that we're talking about today. I think when it comes to the environmental justice, there are different networks. So don't you have a California Environmental Justice Alliance?
Yes, we
California Environmental Justice Alliance, I think, is a really great. And you're talking about collaborating, right? It's alliance. You got people collaborating for different EJ groups, right? Different racial ethnic backgrounds and different parts of California. American Public Health Association. They have a racial equity, race and health series that you can check out, Chris. And then you also have other coalitions. Look at the work of We Act for Environmental Justice. They have a lot of resources. You're welcome, Chris. They have a lot of resources on their website. They're one of the oldest EJ groups in the country. Look at APEN, I think Asian Pacific Islanders is the Environmental Network, Martha? Is that the?
Yes.
And so that's another group to look to as a resource, as a guide to connect on these issues. And I think it'll be really useful if we saw AMA and the American Public Health Association do more work together, actually. I think that would be a way. So working with your LA, PSR, of course, LA, but working with your APHA equivalent and your AMA, if you have an AMA equivalent, would be good. And that's a place to start. But those are things to me would be places to start. There are other coalitions and networks that I work in the Mid-Atlantic region, but in your part of the country, I think APEN is the place to start. The California Environmental Justice Alliance, and then really trying to see what AMA is doing, APHA is doing in California.
Thank you. Those were wonderful resources. I hope you all got that. If not, we will also compile a list of resources and send them out to you after the webinar as well. Okay, and lastly, I want to ask our participants, how will you take what you learned today and all the knowledge that Dr. Wilson dropped on us and apply that to your work and your everyday practice? You can chat that in very quickly because I know we're running out of time and I don't want to keep you all too late. And I know on the East Coast, it's much later. So, but you can go ahead and do that while I go over the next slide. Awesome. So thank you all for staying engaged with us.
Hi.
Hi.
She's been taking notes the whole time.
No, I've been listening.
Smart.
I was editing stories on Storyboard 2.
Okay, cool.
Well, thank you, Dr. Wilson, for your very insightful and heartfelt presentation. I learned so much, and I'm sure our viewers did as well. I want to invite everybody for our next, our other series in the Health and Justice Institute webinar series. One of them is coming up in April, where we will address community health and safety, where we look closely at international relations with respect to warfare and chemical and nuclear weapons and their connections between local militarization and the impacts those have on health. And then lastly, well, our first webinar was looking back at the past 40 years of PSRLA advocacy. And so in our on our webinar in June, we'll come together with all that we've discussed, and we'll envision the next 40 years together. So we'll seek to answer questions such as, what does a just recovery from COVID-19 look like? And what does a just recovery from climate crisis look like? And we'll envision the future together. And that will conclude our Health and Justice webinar series. So I hope you can join us for those as well. And then the next slide, please, Jasmine. Thank you. I also want to encourage you all to become PSRLA members if you're not already. As a member, you will receive timely information about PSRLA activities and research, educational resources and training, and opportunities for action and advocacy. We'll invite you to special events such as this one, and you will be the first to know about our health professional trainings. You'll also be connected to organizations, coalitions, and health professionals working to protect human health, human life from the gravest threats to public health and survival. So you can become a member right now by going to bit.ly/PSRLAMBR. We also have the Health Ambassador Program, where we train residents and health professionals to develop their public policy advocacy skills. So if you want to host a training, or if you want us to host a training with your clinic, hospital, or medical school, please reach out to me. My email is, you should be seeing it on your screen, and we can coordinate that. And lastly, I want to give the floor to Martha so she can close us off. Again, thank you, Dr. Wilson, and thank you all.
Welcome.
Martha?
Sorry, I was muted. I thought I would get away without having that mistake. We're going to continue to work on these issues. We are actually members of the California Environmental Justice Alliance. We're part of Californians for a Healthy and Green Economy, along with Black Women for Wellness, where we're bringing together, issues around chemicals, but also a broad coalition of groups, from day laborers, domestic workers, organizations that are dealing with wellness. And so we've got a lot of those alliances and coalitions. And we really want to continue to work on this. And we're going to work with the LA County Medical Association, who's having their own epiphany about this, because they did a statement and they got pushback from their members. So there's so much work to do. Again, thank you so much for joining us. Thank you, Sakobi. Still mad that you didn't move to LA, but You got to talk
to Natasha about that.
Oh my God. Do you want to move to LA? You should talk to your kids, right? But, really, we want to, and reach out to us if there's other kinds of information that you need or events that we should be doing. We want to do this. I was really happy to see so many members of our national PSR family here on the call today, because I think it's an important conversation for us to have, not just in LA, where we've really made a transformation, but really how to make your organization anti-racist. And, and we're not perfect beings, right? We breathe it in deep, and it's deep in us, right? In so many ways. So thank you for joining us. And I hope you join us on this long-term project of bending the arc of history toward justice and eliminating systemic racism, because that is the thing that is the existential threat to our health, right? And it's the existential threat that allows the others, right? From nuclear war to nuclear weapons to treating communities as sacrifice zones. We have to understand that element of it. And it's 7:33, 3 minutes late, past our time. So again, thank you so much for joining us.
Okay. Thanks, everybody.
Thank you all. Bye.
Bye-bye. You have a good night.
Good night.
Bye.
Thank you, everyone. Bye. Good night.
Bye, Martha.
Thank you.
Bye.